Pharmacotherapeutic management of influenza A, Mimi Manners case study. Meet Mimi Manners. Mimi Manners is 35. She has the Mirena IUD and was diagnosed with influenza A 12 hours ago. She wants to know if anything will shorten her illness. The chosen medication is Tamiflu. It is an antiviral that blocks virus release. It is most effective when started within 48 hours. It is compatible with her birth control and is FDA approved for influenza A and B. Adult dosing. This medication is 75 milligrams orally twice daily for 5 days. It is started within 48 hours of symptom onset. Take with food to minimize GI side effects. And there is no renal dose adjustment needed if the kidneys are functioning normally. Why this medication? Is this the best option now? Yes. Early treatment reduces symptom duration. There are a few alternatives. Our first one is a good alternative, but it is expensive. That is the con, but the pro is it is a single dose. Our second one, it is inhaled, but this is not ideal if there are respiratory symptoms. Our third option is supportive care alone. This is reasonable in healthy adults, but is less effective. Why choose the Tamiflu? It is proven, oral, accessible, safe, and not contraindicated with her form of birth control. When Tamiflu may not be recommended. When it is a mild illness in a healthy, low-risk adult, likely to recover without complications, and the average reduction of symptoms is only 1 to 2 days. The adverse effects possible are nausea, vomiting, headache, and rare neuropsychiatric side effects. The cost-benefit consideration may not justify use if symptoms are tolerable. And the CDC guidelines are that antiviral treatment be prioritized for high-risk groups, like the elderly, the immunocompromised, and those who are pregnant. Pharmacodynamics and therapy goals. Basically, this medication blocks the viral spread, and that results in the 1 to 2 day reduction in symptoms. The goals of this are to shorten the illness and prevent complications and reduce transmission. The pharmacokinetics and interactions. The absorption is oral. It's a prodrug, metabolized in the liver, excreted in the kidneys, and remember to adjust the dose if there are kidney issues. Interactions, there's no interaction with the Mirena. Minimal CYP involvement, which means it reduces the risk of drug interactions. And food is okay because that may reduce the nausea involved. What to monitor? The effectiveness should feel better in 2 to 3 days. The tolerance, GI symptoms, mood, and mental status. Renal function only if there are known issues. Adverse drug reactions. Common reactions: nausea, vomiting, headache, neuropsychiatric symptoms, which are rare, and watch closely in pediatrics or if hallucinations and confusion appear. Patient education. What Mimi needs to know. She needs to take this medication ASAP, ideally within 48 hours. She needs to take with food. She needs to complete the 5-day course, monitor for weird moods and thoughts, and report them. It is okay to use over-the-counter medications such as acetaminophen, ibuprofen, and nasal sprays. And if side effects worsen, she needs to call the clinic or urgent care. Education. Mimi's Flu Toolkit. In Mimi's Flu Toolkit, she'll need her Tamiflu, her thermometer to monitor her temperature, her over-the-counter meds, her water bottle to hydrate, and as much much rest as she can manage. Possible. Clinical assessment and decision. After reviewing Mimi's case, she is a healthy, non-pregnant adult. Her symptoms have been present less than 12 hours, currently mild symptoms. She has no comorbidities or risk factors. My conclusion would be that antiviral therapy is not indicated at this time. The rationale is that benefits of Tamiflu are minimal for healthy adults with only a 1 to 2 day reduction. Side effects may outweigh the benefits in this case. She has a mild case. The CDC guidelines prioritize antivirals for high-risk patients. So the plan is just supportive care and monitoring. And here are my references.